pregnant healthcare workers are apparently being told to keep working, even coming into contact with potential COVID-19 patients, despite the risks to their unborn babies. Well, Joeli Brearly is the founder and chief executive of a campaign to end what they call the motherhood penalty. That's the pregnant, then screwed. Thank you very much for joining us, Joeli.
Good morning, Julia.
Look, I mean, that's obviously a very big concern if you are pregnant, being around anyone who is unwell. But pregnant healthcare workers apparently accuse NHS bosses of putting them and their babies at risk of becoming what they call collateral damage because of the coronavirus by forcing them to keep working on the front line. But we know that many expectant mothers have been told they can work from home or can work sort of in non-front line jobs. But we understand that many are still being expected to turn up to work where they themselves could be at risk of getting coronavirus. And of course, we know that is likely to put their babies at risk as well.
Yeah, so our research has shown that 8% of pregnant workers are working in environments that they consider unsafe. But when we crunch that data just to look at NHS workers, that figure rises to 24%. And 25% of pregnant workers are working with patients that could have COVID-19. That figure again rises when we look at Black, Asian and ethnic minority workers. 31% are working in environments they think are unsafe. And the 3 pregnant women who have died have all been Black or Asian. And we know that Black, Asian, ethnic minority people are more likely to die during this crisis. So this is a huge, enormous, worrying problem. And the government are not doing anything about it. They're not making clear statements about what pregnant women should be doing at this time, and it's causing enormous confusion.
Well, indeed. I mean, just to move on from the issue of Black and Asian, again, Black and Asian people are more likely to be living in big urban areas like London, the West Midlands, where there have been bigger outbreaks, and they're more likely to be key workers. That explains an awful lot, we understand, of why we are seeing that higher death toll. But the key thing here is, I suppose, is whether we know is coronavirus a risk to babies or not, or to those pregnant women, and whether or not, if it is a risk, then those pregnant women should be on lockdown. They should not be out at work at all, certainly not in high-risk situations. And if it isn't, then they need to be told it's not a risk. But it can't be some are able to work and some not. Surely it must be a clear, we should definitely go with safety first when it comes to pregnancy. We are talking about 2 human beings' lives.
Well, exactly. I mean, we tell pregnant women not to eat brie, and we're now saying that they can work with COVID-19 patients.
Yes.
The Royal College of Obstetricians and Gynecologists have said that above 28 weeks pregnant, if you develop symptoms, it's more likely to have a graver outcome than if you're below 28 weeks or if you're not pregnant. Vertical transmission, a woman giving a baby COVID-19 if she has it in utero, is now classed as probable. We don't know very much about this disease, though, of course. It hasn't been around very long. A woman hasn't been early stages of pregnancy, developed COVID-19 and had a baby and the baby be fine because it just hasn't been around that long. So I think we really need to err on the side of caution here. We do know that that it can have graver outcomes. Let's protect pregnant women, particularly pregnant women of colour. Let's protect pregnant women, full stop. Doesn't matter what colour their skin is. Women.
Well, then why did you feel the need to say that?
Because the 3 pregnant women that have died have all been Black or Asian, and we know
the 3 pregnant women have died have been frontline workers, and it is. They don't deserve any. People with darker skin or lighter skin don't deserve any greater protection. There are some simple demographics that explain why it is that we have seen a higher death rate among people who are of colour.
Well, there's an investigation going on at the minute.
There is, but we already know that an awful lot of the explanation will be those demographics because we know, for instance, that Bangladeshis, we're discussing this with Trevor Phillips last week, Bangladeshis have a much lower death rate than white people. So it's not a skin colour thing. It's often it's to do with the lifestyle, the jobs, where people live, etc., etc. I just don't think we need to be bringing that aspect into a discussion about keeping babies safe.
We do need to keep babies safe, all babies safe, all pregnant women safe.
Exactly.
All pregnant women safe.
Yeah, I'm just saying there's a reason why I don't work for the BBC, because I'm just not having that sort of stuff skewed. Let's talk about just saving lives. That's all we need to talk about. Thank you very much indeed, Joeli. Very much appreciate you joining us. At Joeli Brearly, who's from the Pregnant Then Screwed campaign to end the motherhood penalty, and they've looked into the figures on this.